Welcome, everyone, to a special episode of the Living Transplant Podcast. This week, I am going to bring you behind the scenes at the Banff CST Conference and introduce you to some incredible people who are presenting all about their innovation and their exciting ideas about transplant and how to make this entire journey so much more remarkable for potential recipients and donors, caregivers and families and patients and the system as a whole. Thank you so much for joining me, and I'm very excited to bring you different episodes throughout this week, so stay tuned. Today, I am joined by Dr. Marcelo Cypel, who is joining us to talk about his presentation. Welcome.
Thank you for this opportunity.
Yes, thank you so much. So I'm wondering if you could introduce yourself, your name, your connection to transplant, and what you do.
Yeah, so my name is Marcelo Cypel, and I'm a thoracic surgeon and lung transplant surgeon here at UHN. And I also serve as the surgical director for the Ajmera Transplant Center.
Amazing. Wow. And so what would, this may be hard to answer, but what would an average day for you look like?
Very busy, from surgeries starting very early on, sometimes transplants late, clinic visits, many patients rounds in the ICU, and also teaching activities as well as research activities.
Wonderful.
Yeah, so I have a lab that has also many students and fellows, doing full-time research.
Wow. So thinking about that research, you are going to be presenting about universal blood type transplantation. Can you tell me a little bit about your presentation at CST?
Yeah, so we're going to present the data that we actually recently published, but we have done further experiments also since the publication. And what we showed in this study was that actually we could convert organs from blood type A donors to O type.
Wow.
And so they become universal blood type organs. And the main motivation for this was the fact that oftentimes we have very sick patients on the wait list that they can't have the next available organ because it's not the right blood type. And, blood type is the first thing we screen when we have a donor to match, into the recipient. So if we could transform most of our donors in universal blood type organs, then I think we'll create a much more efficient and equal distribution of the donors to the patients most in need.
Wow, that's remarkable. So if this universal blood type became a reality, would that be another step towards making the transplants much more accessible and easier, I guess, for donors to donate to their loved ones, or deceased donation? Could it be used in that scenario as well?
Absolutely. I mean, this could be applicable both for deceased donation and also live donation, right? Because the process that we do to remove those antigens from the organ, which classify them as blood type A or B, is done after the organ is removed from the donor, right? And so there is no implications for the donor itself, but could have huge implications for the recipients. Again, you take the top barrier for organ allocation. I wouldn't say a barrier, but the top criteria is actually the blood type, right? Mm-hmm. So you can, let's say, ignore that now. Wow. And go to the second criteria, which could be, size or, other things that we have to take in account, right?
Mm-hmm. That's remarkable. So for people listening, I think this is an incredibly fascinating and exciting innovation that you have found here. I'm wondering how far in the future would the implementation of this technology be?
Yeah, so I think we'll be able to apply that relatively soon. I mean, this is just to highlight, this is being done in collaboration with some investigators from UBC, University of British Columbia,
Wonderful.
who helped develop the enzyme that actually cleave the sugar from the cells. And this sugar, again, the A blood type is a sugar that is on the surface of the cells that cover the blood vessels. The preclinical studies we have done in using human lungs, they have shown that we can remove 99% of these antigens. When we reintroduce blood from a different blood type into the organ, we didn't see any signs of rejection, right?
Wow.
Now, we still don't have data to know long-term what will be the effect.
Mm-hmm.
And because it's difficult to have animal models because animals have different blood types, it's difficult to study this in animal models. But we feel that we can start this in the clinical setting by using a subset of donors that have low expression of the antigens to a subset of recipients that have a low level of antibodies, right? So it will be kind of a gradual introduction of this into the clinical practice, because those two groups, even if there is, let's say, if the enzyme doesn't work, okay, mm-hmm. there is still ways of treating those patients and they can do well.
Wow.
Okay? So that will be kind of our safety net for the beginning. And I believe in 2023, we'll be introducing this to the clinical arena in this population.
Wow, that's remarkable. That's fascinating.
Yeah.
Is there anything else that you would like to share either about this incredible research or a message to the potential recipients or potential donors about what that impact could be for them?
I think the main impact would be that we'll be able to transplant sicker patients sooner, mm-hmm. Because we'll be able to allocate the next organs for them. The other comment I would like to make, although our work was done exclusively in lungs, mm-hmm. this is applicable to all organs, right? So the mechanism that the enzyme cleaves, the sugar is the same in any organ. And in fact, recently, a group from the UK has followed our footsteps and have done some pilot studies in kidneys as well, without transplantation, just on the preclinical side. But this is just to show that I think this will come to all organs in the future and will help a lot. I think we'll learn a lot when we do the initial clinical trials. But I think the potential as a clinical surgeon that I receive the offers every day, I can see the need for that.
Yes.
And also not only will facilitate more equal distribution, but also there are situations where sometimes we receive a donor offer from a specific blood type, mm-hmm. and we don't have the right recipient to match for that organ.
Right.
And so those organs are often not used. Right. And so we'll be able then to use also more organs mm-hmm. for transplant that could be discarded in the current practice.
Amazing. Some people, when they were initially talking about transplant, because of their blood types, they were told 4 to 6 years or potentially longer for a deceased donation. So this could potentially help those people as well, so that they don't have to wait as long when they have those different blood types.
Absolutely. I
Wow.
think for kidney, the main impact is exactly that. Will shorten the wait list time. Fortunately, the kidney patients, they can still stay on the wait list doing dialysis. It's not, a pleasant thing, but they stay. But this is very important, again, because the wait time adds complications, morbidity, and so on. Now, for other organs, like, for example, lung and heart, that could represent the difference between being alive or dying, because they can't wait the 1 or 2 years.
No.
We're talking about usually months of wait that these people can have.
Wow.
So I think will be benefits on both sides. Each organ will have the specific benefits. Overall, I think the whole transplant field will benefit from this concept. There are still more studies to be done before we can say that it's a home run for the technology. Yeah.
Wow. Recently, we had Dr. Humar on the podcast, and he talked about the Ajmera Transplant Center's, Hail Mary, incredibly transformative goal of eventually ending wait lists for potential recipients. And I think listening to you today, it's another example of one more innovative technology that Ajmera team and people across Canada have created that are going to bring us one step closer to ending that wait list. Thank you so much for talking to me today and for all of the remarkable work that you do. We're really appreciative of having someone like you in our corner.
Thank you. Yeah, thank you for the opportunity for explaining this.
Thank you so much.